Kia ora koutou. I will hand over to Lizzie Barratt in person. I'll be here for questions and to awhi Lizzie. Kia ora.
Very good. Lizzie, thanks for being with us. We'll hand over to you for your 10-minute presentation.
Tēnā koe. Kia ora, tēnā koutou katoa. Ko Lizzie Barratt tōku ingoa. I'm a health promotion advisor making the submission on behalf of Alcohol Health Watch, a national organisation funded by Te Whatu Ora. Our work functions through a health promotion approach and is therefore committed to preventing and reducing alcohol-related harm. We commend the government for introducing the Stalking and Harassment Bill and support its intent to better protect people from stalking in Aotearoa. However, we tautoko the strong opposition to the bill's proposed definition of stalking alongside the specialist experts you've heard from already. This definition increases the immense barriers to support women are battling to be believed. We emphasise the input to this select committee that women are tired of being dismissed and deserve better. We recommend that this definition is strengthened in line with international standards by defining stalking as a minimum of 2 acts within any time period. We also oppose the bill's current punitive approach, which misses a crucial opportunity to address the complex factors underlying stalking behaviours. Stalking and mental health and addiction challenges often intersect, being underpinned by strong feelings of obsession, jealousy, and insecurity. We know both intuitively and empirically that substance misuse has a huge impact on gendered violence, and that alcohol spearheads this burden of harm, being involved in over half of all physical and sexual assaults and the most commonly used date rape drug in Aotearoa. And stalking is no exception, with international research showing that 1 in 5 stalkers had used alcohol immediately before or during their offence. These appalling statistics are underpinned by our experiences that there is nothing quite like alcohol to validate male feelings of entitlement and ownership over women's bodies and lives. But substance abuse remains broadly under-acknowledged in our violence prevention policies, strategies, and plans. This omission normalises and reinforces intergenerational cycles of violence, mental health challenges, and alcohol misuse and addiction, which persist among whānau communities and our society as a whole. It's left our systems ill-equipped to address these currents of harm, and it perpetuates the insidious double standard that women are more likely to be abused under the influence of alcohol and then to be blamed for it. It also results in the chronic under-resourcing of community service providers who continue to support people experiencing these challenges under ever-increasing pressures. Alcohol is never an excuse for violence, but the evidence that they are so often interrelated warrants your consideration in this legislation. And not just among stalking perpetrators, but also for survivors who face compounding barriers to support. Despite the fact that more than 1 in 3 women who have survived abuse experience substance use disorders, stigma and discrimination continues to prevent them from seeking help. It's even harder for survivors to come forward about their experiences when substance use is weaponised by their stalkers to assert that they're crazy or lying or deserving of the abuse. We therefore recommend that you take advantage of this bill's potential to break the cycle by mandating the consideration of stalker rehabilitation. This should explicitly include non-violence and alcohol and other drug treatment programs as crucial prevention measures, not just regarding reoffending, but also to ensure the safety and well-being of children and whānau. Health-based responses to violence are more effective, ethical, and have broader benefits across the life course than simply locking people away for their behaviour. But law change can only do so much, and we emphasise the need for a national police training program to ensure that concerted responses to stalking are implemented at the ground level. Finally, we recommend addressing substance misuse as a crucial component of broader violence prevention and intervention efforts. In Newcastle, Australia, reducing alcohol outlet trading hours reduced domestic violence assault rates by 29%. This change has been estimated to prevent 204 family and domestic violence assaults over the nearly 12 years it's been sustained. Norwegian research has similarly found that each 1 hour reduction in trading hours is associated with a 16% reduction in recorded assaults. Strengthening our alcohol regulations is a common sense policy lever which can contribute to reducing our extreme burden of family violence and sexual violence. We're therefore calling on you to break the status quo and act on the well-established and primarily government-commissioned evidence-based that reducing alcohol availability reduces alcohol-related harm, including gendered violence. Women and children deserve to be better protected from the increased volatility and severity of abuse resulting from alcohol consumption, including that related to stalking. We should not be the ones having to bear the burden of harm resulting from others drinking. Thank you for your time. We're happy to take questions.
Thank you, Lizzie, and thank you